Are you tired of running to the bathroom all the time? Because if you don't go when that urgency hits, you're going to have an accident. And worse, the constant nighttime urination, having to wake up multiple times so you can go to the bathroom, barely unable to get a good night's sleep. If any of these symptoms sound familiar, then you may be suffering from something called overactive bladder, and that's what we're going to talk about today. Hi everyone, I'm Dr. Nabila Noor, a board-certified and fellowship-trained urogynecologist and a pelvic reconstructive surgeon. If you're new to the channel, here we talk about everything pelvic health. So if you like what you see, don't forget to subscribe and share it with a friend. And at the end of today's video, there is a freebie, so keep watching. So let's start with what is overactive bladder. Overactive bladder is a syndrome and it consists of various different symptoms. First symptom is known as urinary urgency. That's the feeling like they have to go and cannot control that sensation when they have the urge to go. I have patients who describe that they may get out of their car and just as they're putting the key to their door, they have this sudden strong urge where they feel like they can't hold anymore. By the time they run to the bathroom, they're already leaking in their pants. Similarly, I have also heard other patients talk about, they could be fine and then all of a sudden they hear the tap water running and this sudden urge hits them. And again, if they don't make it to the bathroom right then and there, they're going to have an accident. The second symptom is what we call urinary frequency. So going to the bathroom 8 times is considered normal. But if you're going more than that during the day, then that's known as urinary frequency. Sometimes patients can be going every 2 hours, but I've also heard patients complain that they're going every 30 minutes, if not every 15 minutes. And you can imagine how debilitating that can be. And it's not like every time they're going, there's a lot of urine coming out, but it's that sensation that they have to go or else they'll have an accident. The third symptom is what we call nocturia. So this is where patients are waking up at night to go to the bathroom. Now, waking up at night once is considered normal, but if you are getting up at night more than once, or worse, if you're getting up to go to the bathroom every few hours where you're barely able to have a good night's sleep, then that's not normal. And finally, the fourth symptom is urgency-related urinary incontinence. So this is leakage associated with urgency, as we talked about. Now, a lot of women suffering from overactive bladder may have all these symptoms, while some other women may have only a few of these symptoms. Believe me, it is more common than you think. Globally, there's about 12 to 16% of the adult population suffering with overactive bladder at any time. That's millions of people who are suffering with this condition. And it's not just a quality of life issue and an irritating problem. The cost of treating overactive bladder, even without any kind of medications or invasive procedures, can be significantly expensive. Think about what these patients suffering from overactive bladder have to do. They're buying incontinence pads or absorbency pads, which can be really, really expensive. In the United States, the cost can range anywhere from $50 to about $100 a month. For a lot of women who are going to the bathroom every few hours, they're unable to have a job because their employer may not be supportive of their health condition and may not allow them to have the appropriate breaks that they need without embarrassing themselves. For my patients who are having to get up at night multiple times, they are exhausted during the day. You can imagine how that will affect their productivity. Not to mention, for my older patients who are suffering with nocturia, having to wake up at night and rushing to the bathroom is a significant fall risk. It's not uncommon for any patients to fall and have a hip fracture or worse, hit their head against something hard and then have a brain bleed, which can significantly increase their morbidity. So why does overactive bladder happen? Before we talk about that, let's talk a little bit about what happens to the bladder as it fills up and as we empty it. So normally our bladder is surrounded by a muscle called detrusor muscle. So as urine fills up our bladder, those detrusor muscle relax, which is what allows our bladder to stretch like a little balloon. When the bladder is full and they have reached its capacity, those bladder muscles start to spasm. And that's what gives us the signal or the cue that we have to go and empty our bladder. Our bladder sends a signal to the brain. The brain determines if we are in an appropriate situation, meaning are we close to a bathroom? And if we are, we go to the bathroom, we relax our pelvic floor, our bladder muscle contracts, and then we have urination. So what happens for patients with overactive bladder is that this whole signaling between the bladder and the brain is not working the right way. And there could be a whole host of reasons why that happens. Let's talk about some of the more common causes. Number one is any kind of neurological issue. So these could be patients who have underlying neurological conditions, such as multiple sclerosis, Parkinson's disease, Alzheimer's disease, maybe some sort of spinal cord injury or a spinal cord tumor, maybe history of stroke or a brain tumor. Anything that can affect the signaling between the brain and the bladder can exacerbate their urinary symptoms. Number two, patients suffering with any kind of low back issues. The nerves that's controlling our bladder actually comes from our lower spine. So patients who have significant damage to their lower back or their lumbar area do notice worsening of their urinary symptoms. There There are irritants in our diet, whether it be in our food or our drinks, that can irritate the walls of the bladder and cause them to spasm unnecessarily. Things like caffeine, soda, tea, any kind of carbonated beverages, foods such as spicy food, citrusy food, artificial sweeteners, alcohol, all these things can irritate the walls of the bladder and give patients the false signal that they have to go even if their bladder is not full. Certain medications such as water pills, which gets rid of excess water from our body, can make patients go even more. So those can cause symptoms such as urgency, frequency. Being overweight. Obesity is a risk factor for any kind of urinary leakage, and it's well studied that it can make symptoms of urinary urgency and frequency worse. Not to mention that patients who are heavy may also have other underlying conditions such as hip issue or knee issues, which makes it more difficult for them to rush to the bathroom when they need to use it. Hormonal changes. As women go through menopause, there's a decrease in estrogen in their bodies, and estrogen is important not just for the vaginal health but also for bladder health and urinary symptoms. So in the absence of estrogen, patients can complain of urinary urgency, frequency symptoms, any kind of bladder abnormalities or foreign objects. Patients who may have had previous surgeries near the bladder or injuries to the bladder. Sometimes we do procedures such as a sling procedure where we use a piece of mesh, which is a synthetic material, to help women with leakage of urine. If these surgeries are not done correctly, then there is a risk that the mesh may migrate into the bladder wall, which can irritate the walls of the bladder, causing patients to have symptoms of overactive bladder. Finally, any kind of bladder irritation, which could be because of infections or bladder stones, or worse, bladder tumor. So as you can see, if you're suffering from any of these conditions, it could be something benign or it could be something concerning, such as malignancy. So when patients have symptoms of the overactive bladder, it's important to rule out any other etiologies that could be causing some of these same symptoms. Things like infection or any kind of bladder pathology or any kind of foreign object in the bladder. Once we rule this out and we have diagnosed somebody with overactive bladder, it is important to get them on a good treatment regimen. The good news is there are lots of treatment options, a lot of which is conservative options, which can be really beneficial for patients who may not want something more invasive. I have a separate video where I talk about the treatment options for overactive bladder, so definitely check it out. So if you or somebody you know is suffering from any of these symptoms of overactive bladder, please don't suffer anymore. Know that there are lots of amazing treatment options that we can get you. Talk to your primary care doctor, talk to your OBGYN, get a referral to see a urogynecologist or a female urologist who can do a good evaluation and give you the proper diagnosis and get you in the proper regimen plan. As promised, I do have a freebie today, my free overactive bladder health guide. If you want it, press on the link below. It's completely free and hopefully you find it helpful. For more helpful tips about your pelvic health, don't forget to subscribe. Hope to see you soon. Bye!